investments in our nation's history into public research and development. These investments will help ensure the United States remains a global leader in innovation for critical and emerging technologies such as artificial intelligence and quantum computing. Unfortunately, it has been reported that the Trump administration is considering reducing the National Science Foundation, their annual budget, by up to 66%. And I believe this would be a disastrous step backwards in the international race to invest in and develop these technologies. So, Mr. Kratsios, do you support the bipartisan investments that have been made under the CHIPS and Science Act?
I generally have for many years supported the important role that federally funded early-stage basic pre-competitive research plays in the ecosystem.
So is that a yes as far as the CHIPS and Science Act?
I think components of the CHIPS and Science Act are extremely important for ensuring U.S. leadership in semiconductors and the broader AI ecosystem.
Okay. Do you think it would be wise to reduce the budget of the National Science Foundation and cut back on these critical investments in research and development?
I can't speak necessarily to the top line of the National Science Foundation budget.
Well, 66% is what we've heard floated.
So I'll defer to the president and OMB as they decide those top lines. But to me, I think what's important is, in some sense, the absolute number, but more importantly, how the dollars that actually are budgeted and ultimately appropriated are spent, and prioritizing them in areas of national interest. When I served as the U.S. CTO in the last administration, even in constrained budget environments, we spent a lot of time trying to ensure that we're prioritizing investments in the areas that were most critical for the future of American prosperity.
But you wouldn't rule out a 66% cut in NSF funding?
I would defer again to the process that the president and OMB are going to lead.
Thank you. We know that in order to remain a global leader, we need our best and our brightest, regardless of their gender, their race, their ethnicity, their sexual orientation, to be on the front lines in these research careers. That is why the Bipartisan CHIPS and Science Act requires OSTP to develop and publicize guidance to federal laboratories and universities on best practices to help identify any institutional barriers that limit the recruitment, retention, and advancement of women and underrepresented minorities in STEM research careers. So, Mr. Kratsios, do you believe President Trump's executive order ending DEI programs contradicts this bipartisan law? And do you commit to executing this OSTP directive in the law, even if you're directed by President Trump not to?
I do not believe that the DEI executive order is in conflict with the law. I have for many years and will continue to advocate for all Americans to be able to pursue STEM degrees. In my opinion, there are not enough Americans pursuing advanced degrees in STEM, and it would be my priority, and if I was to be confirmed, to try to get as many Americans as possible to go back into the STEM fields.
Thank you. Mr. Medor, I really appreciate your taking the time last week to stop by to discuss some of the critical issues that are before the Federal Trade Commission. In our meeting, we discussed our shared concerns around the market consolidation in the healthcare industry. I appreciated hearing from you about your perspectives on private equity's acquisition of hospitals, physician groups, and nursing homes. Can you share with the committee what role you believe the Federal Trade Commission has in the interest of healthcare quality and costs?
Thank you for raising that topic. The FTC plays a critical role in its antitrust enforcement duties to ensure that our markets remain competitive. That includes both preventing anti-competitive conduct, but also policing mergers to ensure there's not undue consolidation within any individual market. There, it's important to look at the competitive effects of a merger, regardless of who's purchasing it, to ensure that in the aftermath, we're going to have a competitive status quo, that competition will be maintained so that all healthcare providers feel that need to continue to provide better quality services to the patients.
I thank you. Since I only have 20 seconds left, Mr. Kratsios, you may answer this either here or for the record. You come to this role with significant prior experience with artificial intelligence. With respect to healthcare, I want to know what role you believe AI has in our healthcare systems, and what, if any, guardrails you think should be in place.
I think one of the greatest and most impactful applications of artificial intelligence will be in the world of healthcare, from drug discovery to the way that we operate our healthcare institutions. So there's a tremendous opportunity both at places like HHS and in the private sector to make an impact.
Thank you. Senator Kirk.